Well, good afternoon. I'm glad to be here with my colleagues today to discuss Obamacare 1 year later. The more the American people get to know about this $2.6 trillion health law, the less they like it. In the end, it might have been over 2,000 pages long, but the American people understand it pretty well. In short, the White House and its Capitol Hill allies passed an unprecedented expansion of Washington power with massive new subsidies for coverage and without addressing the number one concern of the American people, and that is skyrocketing health costs. All of this was paid for with billions of dollars in new taxes and by taking money away from an already struggling entitlement program. The American people understood that the historic expansion of federal power and the creation of new bureaucracy is never going to cease, but it would never increase efficiencies and make care more accessible. So 1 year later, what do we know about this law? $2,100 in higher premiums, 800,000 fewer jobs, $118 billion in new unfunded state mandates, $311 billion in higher health care costs, $529 billion in Medicare cuts to fund new entitlement spending, $813 billion in new taxes, and $2.6 trillion in new federal spending if we're lucky. It's probably going to be more than that. You'd be hard-pressed to find a more economically destructive piece of legislation. Just last week, the Congressional Budget Office concluded that, quote, growth in health care costs will almost certainly push up federal spending significantly relative to GDP under current law, unquote. So much for bending the cost curve the president promised. All of this damage comes before the Medicaid expansions and the new premium subsidies for the health law's insurance exchanges. In fact, the Secretary of Health and Human Services has the authority to waive these Medicaid mandates that states are begging to get out of. But the administration seems to be looking for any way to maintain this massive expansion that our states just simply cannot afford. Yet the American people's opposition to this law isn't solely based on bad policy, but also the lack of transparency on how it was enacted, what the true cost is, and how it's being implemented. They used every budget gimmick in the book to hide the true cost of this program so they can argue that it reduces the deficit when in fact it doesn't. They double-counted money to both, quote, shore up, unquote, Medicare, while simultaneously using it to fund this new health law. If that isn't fuzzy math, then I don't know what it is. And according to the Congressional Research Service, roughly 83% of the final rules implementing the health law circumvented public comment, which is typically required by federal law. Now, I guess this administration's pledge on transparency is another discarded slogan, discarded when it became an inconvenience. Just yesterday, Senator Enzi and I reminded the administration of its failure to brief Congress on the health law's implementation. This includes a failure to respond to 67% of Republican member requests. But Secretary Sebelius today refused to commit to answering those requests within 30 days, as I asked her to do. 1 year later, it's abundantly clear that this law is a budget buster that raises taxes, increases already skyrocketing health costs, puts bureaucrats between patients and their doctors, all while putting our already fragile entitlements on an even worse fiscal footing.